Hey, great Sunday evening. It is a pretty fair day in the city of Brownsville. Thank y'all, everyone, for coming on short. Never any news about the double homicide. We'll talk about the double homicide in a little bit. A very tragic situation, a very, very sad situation. We'll talk about a little bit of it, not too much, not even a pre-show music side. Sorry, David. Cuando quieras yo te canto. Nina, hello, how's it going? Buenas noches, guapos. Ah, los tres nos dijo guapos. Es lo bueno. Mi Belinda es buena. Joe, my man, God bless. Hey, Baba in the back.
Yes, sir.
Hello. Los cuatro guapos. Hey, Saucillos. Guys, and let's start off very quick while people start coming in with the information that we just received in regards to Hidalgo County. Hidalgo County is reporting 547 new positives over the 4th of July weekend. 547 positives throughout the 4th of July weekend. Dr. Eder Hernandez is with us tonight. That's my no introduction. Ya es de la casa, Dr. Eder Hernandez. Dr. Eder Hernandez, 547. I mean, goodness gracious.
Yeah, it's a serious matter. We also have a testing facility over in McAllen. We have one of our third facilities, urgent care, and I know that today we reported about 20 positives out of that location in McAllen.
Wow!
And the demand is so big in McAllen. Unfortunately, we are very limited at that location. We just go by appointment. I don't have a major drive-through because all of our efforts are in Brownsville, Texas. So that's just a satellite location, but it is tremendous out there. The amount of infections that are going on in Hidalgo.
Well, let me ask you, Doctor. Do you think that Hidalgo's point out all these numbers because they have a greater population than we do, or is it something that we could consider a trend? And are we soon to be the next Hidalgo?
Well, the reality is, all those cities they intermingle. So you have, Far San Juan, Alamo, Edinburgh, and then you have everything on the south side, close to the border, 281, and it's just, everything's intermingled. There's a lot of commercialism. There's a lot of people coming across from the border. So I think the population is denser, so we expect to see, a couple hundred more positives in those locations than here.
But we're not out of the woods by any means.
No, we had an eventful weekend. We've been working as of Saturday morning. I had 5 advanced practice providers and a physician involved in the treatment of over 200 positive cases. So we consulted over 200 positive cases between Saturday and Sunday. Today alone, 95. Tomorrow our day is starting with 60 positives. So it is something that is extremely. We're bearing a lot of weight. We're feeling the pressure. We're feeling ourselves. Getting tired in the sense of now there's more and more positives, and at the end of the day, with what we saw from 4th of July, in 1 week we're going to be devastated with the amount of positives and complications. Oh my goodness, it's going to be tough, man. I actually don't know how we're going to survive as a community, and the hospital system is already overwhelmed. It's going to be very, very tough. It is extremely difficult.
Doctor, we've seen how the state of Texas has sent reinforcements down to the valley in particular. With this, surge in numbers, is it fair to say, or is it okay for us to say that we have a crisis on our hands?
No, this is a crisis. I think the governor should act quick and call it a disaster, so we can get FEMA involved, get federal help. As of this weekend, I believe that the federal government will be testing out of a Berghagen Arena, according to what we saw. So there is, I think the federal government has their eyes on the valley, and unfortunately, what we didn't want to happen 3 months ago has occurred. Our ICUs are filled. doctors and healthcare workers are getting infected. People are getting infected with the virus. So how do you expect? We have a few amount of intensivists, and if they get sick, who's going to take care of you in the ICU? I have no experience in the ICU. My experience is in the outside,
Right.
high volume clinics, outpatient setting. And imagine if these doctors all get sick, who is going to run your ventilation? Who is going to help you? How is this going to work? These gentlemen are not machines. They're human beings. They have families, and I can tell you, in this point in time, families is extremely important. And so if those gentlemen get sick, then who's going to run those ICUs? So it gets very complicated, and they're feeling the pressure now with those complications. We've been feeling the pressure since day one, but now it's overwhelming. Now the numbers are through the roof. I'm reporting
Dead.
256 positives, 256 positives, 101 on June the 30th, 95 for July the 1st, and July 2nd has 58 positives. I'm still pending results from July 3rd, and those will come in tomorrow. So I expect to be at over 300 in a period of 3 to 4 days.
Well,
Um,
my concern, Dr. Hernandez, and let me say this. One of the things that we see in all these comments, and I know that they're hard to read because there are so many coming in, sir. But one of the things that I see in the comments is that there's a lot of individuals out here that have, said that their loved ones, family members. I think your brother is on here as well, and he made mention that he has some individuals out there. I think everyone is starting to know someone who is passing away. I mean, there are many individuals out there that are, passing away. So it's starting to hit home a little bit more. And I think it's fair to say, Dr. Hernandez, that the numbers are only going to continue to increase in the next couple of weeks, couple of days.
Yeah, unfortunately, we got word. I've been a PA for over 13 years in the community, and I've developed relationships with patients for a long, long time. And one of my dear patients passed away. She was 52 years old. I've been taking care of her for years. She was very, very, very well controlled. And at the end of the day, this virus is a vicious virus. It'll take your life within a week. You're gone in a week. One of the major risk factors that I am seeing that is very disturbing is morbid obesity. If you're considered morbidly obese, the virus tends to be more aggressive, tends to affect those individuals. They decompensate very quickly. So we need to continue our lifestyle in the sense of focusing on patient education, diet, and exercise. Even if you're at home, do something, because this virus is a vicious virus. Is unacceptable to compare it to anything that has to do with the flu. Like all these other naysayers are saying, well, the flu is worse. Let me tell you this. I'm a national speaker for a novel flu drug. I've spoken in Austin, San Antonio, Edinburgh. I've spoken at conferences for this national flu drug. The flu does not compare to how vicious this virus is. This virus has mutated. The experts have seen that the virus has mutated to become more infectious, guys. I'm going to post a link to Frankie and to Erasmo so you guys can see this virus is now mutated to be more vicious and aggressive. So the infections are going to increase. How do I know this? We've talked to 200 positives in the last 48 hours, 200 positives. When you talk to them and we ask them, how did you contract the virus? The number one thing they're saying now is, I don't know how I got it.
Yes.
That's
Two
scary.
months ago, 2 months ago, it was, I got it from a family member.
Right.
Okay, it was linked to family. Now it's, I don't know how I got it. I've been isolating at home. I took a trip to Walmart. I went to get my groceries, and that's all it took.
Right.
Okay, that is very serious. The community spread is extremely high, and now we're all, everyone keeps saying that, I've kind of pushed. There's a lot of folks in there saying that I've pushed fear mongering.
No,
that we're pushing fear.
no,
There's several gentlemen earlier today. Look, we don't want to give you fear. Okay, we want to give you the truth. We want to give you the
exactly.
numbers.
Well, see,
We want this is transparency.
yeah, that is something that's very important that you mentioned because we're speaking about it every day, sir. We're speaking about it every day, and we tell people we don't want you to be in fear. We want you to be cautious. We want to give you the data, the information. We want to let you know what's going on a daily basis, so that you could decide ultimately, to take care of yourself and take care of your family. Sir, I don't consider it fear mongering at all. The problem is you're going to encontrarte con gente cabezona que no hacen caso. Les puedes poner el muerto ahí enfrente and they're still not going to listen. And a lot of people have said it. It's not till it starts hitting home that a lot of these people that y'all are just fear mongering. Y'all nomás quieren asustar a la gente. It's not till that moment, sir, that people are going to sing a different tune, which we're starting to see it, man. We're starting to see people
Yeah.
de que ahora ya dicen, oh, well, ya, ahora mi tío se está muriendo. Ahora mi tía está en el ventilator. Ahora sí. Pero weren't you out there over there telling people, no, hombre, it's a hoax, están echando mentiras, nomás quieren hacer dinero y que los hospitales.
I had an individual that I consulted yesterday. He was a positive. The gentleman, I couldn't get him off the phone without him saying that we as medical professionals are making money to give a diagnosis of COVID-19. That's how much stupidity is out in the community with COVID-19.
It's true.
I do believe that the hospitals have some type of reimbursement that is related to COVID-19, and
And
I
they
think
need
that
it.
has to do with the increased risk that they have, right?
Yeah, they
Um,
need
uh,
it.
I don't know more about it, but as a private clinic, we don't get reimbursed because we more money or more income if we diagnose you with COVID-19. That is sickening. That is difficult to swallow when we're going out there putting our lives on the line. My staff has been relentless. We've had people almost pass out at the sports park.
Yeah, I believe it.
Okay,
I've seen it.
we've had to deliver Gatorades, waters, swap out the employees so they don't pass out. Because they're in the heat and they're covered in PPE. So I mean, we need to get a little bit more love. We need to get a little bit more help. And how are you going to help us? You're going to help us by realizing that now we're in full blown community spread. You're not safe anywhere that you go. You have to treat every individual that you talk to as infectious, okay? Because you don't know their status. For right now, we need to put a break on this. Unfortunately, as you saw the pictures from 4th of July, I don't know how we will tolerate this in the next week.
No.
Um, I'm not saying we're gassing out, but it's very taxing on a human being to manage, this type of pandemic when people are not listening, following guidelines, and now the ICUs are full and we're
Ah,
stuck.
let me tell you, Dr. Hernandez, I'm at that point where I'm losing it with these individuals because look, that point in regards to the hospitals, oh well, they get $30,000, and I'm going like, well, yeah, that's a great thing, guys. If our hospitals, our local hospitals are getting reimbursed $30,000, more power to them. Let them start using it because they are jam packed. I mean, I have communication with individuals that are working inside the hospitals, the nurses, everyone in there, and they're all concerned. And like you mentioned, Dr. Hernandez, they're out there pulling 2 shifts, 3 shifts. I mean, they need some form of relief. And let me tell you, if the hospital gets more money, they'll probably open up and get more resources out for the people. But you mentioned something in regards to the 4th of July. A lot of people have been asking. You know that our 4th of July, we saw the cams, the South Padre Island cams, and the different pictures. And there's some people out there showing different pictures. Guys, pictures don't lie. What even surprised me was that then they started to move the cameras so that they wouldn't focus on the people anymore, which is really, really zero transparency from the part of South Padre Island. But a lot of people are concerned, Dr. Hernandez, that after the 4th of July holiday, lo que hizo la raza, not only at South Padre Island, but all those damn cookouts and all those get-togethers, they're going to put us in a bad spot, sir.
So the top three infections now, when I talk to individuals, these last 200 positives that we consulted over the weekend in 48 hours, the top three are family gatherings. People cannot stay away from their own family. We have that mentality, right? That we're all, we families stick together, and you haven't seen them for a long time. They come over, and that person has been exposed at work, and then now you're infected. Okay, so the reality is, we have we have uh, we have one we have a number one type of infections from family gatherings, and the second infection is from restaurants, bars were big, and I think the governor pulled the plug on the bars very quickly. I think after he realized that he was, it was not right, and now the third source of infections is South Padre Island. I've spoken to so many patients that they told me we took a trip to South Padre Island. We stopped by the Wingstop. We went to the restaurants, and that's how we got it.
Sure.
So the reality is
Just to answer Claudia's question, Claudia's been asking, and I would dare say, Claudia, that I think the leadership here is considering bringing in more testing. Claudia's been saying that she hasn't been able to get tested. She's already gone to BTX Cares. Other doctor, are we to expect more resources in regards to testing for people out there?
so some of the and Claudia can message me, probably message me, and I can help her tomorrow. I've been doing that. People that have been messaging me with those concerns, I have been able to help them.
Thank you.
The reality is the following. This is what happened in the city. In Brownsville, the reality is that a lot of clinics were not testing early for COVID-19. As people wanted to test later for COVID-19, supplies became scarce, guys, throughout the state, right? And so, unfortunately, now that people want to test, there's no supplies, right? Another disaster, Frankie, that occurred not this Friday, but last Friday, the largest lab, the largest lab in the state that deals with COVID-19, which is one of our main accounts, canceled all the accounts in the state of Texas. Okay, they canceled the hospital's accounts. They had canceled our accounts. They were so bogged up with over 100,000 samples, and they just said overnight. They told us we're no longer testing. Okay, wow. That was a disaster. But let me tell you what we did. Okay, us being the patient advocate and not giving up. At the end of the day, these are the facts. We made a deal with UTRGV. Okay, so now we are in partnership with UTRGV. They are one of our reference labs at the sports park. And now they've run all of our tests from Monday through Friday, and starting tomorrow, that lab now has opened their doors back to us. So now we have two labs to choose from. We are able to move faster, and there's a third lab that's coming. So at this point, we will not focus just on one lab. We're going to have different sources to be able to help folks. But the demand is very high, guys. Encourage your doctors, your clinics, your private clinics to test, to do whatever they can to test, because the numbers are outrageous.
Doctor, at the beginning of this COVID pandemic, we got word that this was targeting the elderly a lot. It was very prevalent in the elderly community. Now, lately, we've been seeing deaths in Hidalgo County in the 40s, 50s, 60-year-old, a very young age group. And then now we get confirmation from Cameron County of a 23-year-old. Is this something to worry about in the sense of we have been hearing that the main reason of people passing away from COVID-19 is underlying conditions? When I think of a 20, of a 30, of a 40-year-old, I think of somebody strong. Is it fair to say that this COVID-19 is affecting people who don't have underlying conditions?
And I think we go back to the conversation we had earlier about the mutation. I believe the researchers have looked at COVID-19. It has mutated to become more infectious, and we don't know the virulence or if it's more aggressive or not, but that is mutated since January to now is mutated. And now we're seeing people at 60 years old. We started at 80 years old, 70, 60, 50. Now there's 40-year-olds. I had a nurse contact me over the weekend. Nurses are being put through the ringer. They're battling depression, anxiety. They're being overwhelmed, overworked. Some are about to quit, and now we're actually treating a lot of these individuals for mental strain.
Yes.
They're overwhelmed,
Yes.
and imagine if they crash. What are we going to do as a community?
It's crazy.
So now I think Frankie's pointing out an excellent point. Is it really that you have underlying conditions, or is it really that the virus has mutated so much that it's so darn aggressive, and that now people are dying in the 20s, in their 30s? You know, how real is that? That's difficult to manage.
Dr. Hernandez, one of the concerns of Samuel, and it's one of the concerns of a lot of parents out here in Brownsville, sir, and throughout the valley, I would say, probably throughout the state of Texas. So what's going to happen when school starts? We do know that our students are being asked to come back for conditioning and training onto the campus on July 13th. And that's this coming week, sir. Is it too soon?
Well, the reality is this. I strongly believe we should not have school for the rest of the year.
Amen.
You know, let me tell you this. Um, if you send your child to school, there's going to be one child in that classroom where a parent was disobedient, was hanging out with the buddies drinking, was having people over, was in not social distancing, and that child's going to get infected. Now, children become asymptomatic carriers a lot of the time. They have no symptoms, okay? But that child goes into the classroom and infects 10 other children. Then they take it back home. Now the whole family is infected. Now you have family clusters. Instead of having one family cluster, you have 10 family clusters.
Exactly.
So it's disaster.
It's
No,
just that.
I will not send my children to school at this point until we have a vaccine or we have control of the virus, because we don't have control because people don't have control in their own mindset.
Dr. Hernandez,
You know,
this is the model that I've been using, and you correct me. I mean, you can correct me anytime. Correct me if I'm wrong. You've got a classroom meeting with 22 students, because they're talking about 22 students, sir. You got a classroom meeting with 22 students and one teacher. Out of these guys, they'll come in here. One of them will have the virus, and then they're here all day long, sir, all day long, and they're mingling and mingling. And then these 22 plus the 23 are going to go home. What's going to happen, sir?
multiple spread family clusters, those become 100 infections.
It's going to be a disaster. A disaster. That is why my suggestion, sir, and I think that we're on the same page. My suggestion has always been, continues to be, sir, we do distant learning as much as possible until January 2021, and then reevaluate the situation to see where we're at. We are nowhere near peaking. We have already got a virus that has started to mutate up in Houston, Texas, sir. And they say that the second wave is going to be worse than the first wave. And these people are planning to send our teachers, our counselors, our coaches, our band directors, and our students back on campus in August, sir. That's 3 weeks away. That's madness.
Unfortunately, there was already deaths in the BISD system. So the reality is no one is exempt for the virus. Doesn't matter where you work or your age group. At this time, you know, we need to take safety measures into our own hands. HEB has been a problem. There's been infections at HEB. I've seen infections at Walmart. I've seen infections at restaurants. You know, you guys, I encourage you to call the health department. Okay, the health department can't tell you where these infections are coming from. Okay, so me, in general, without giving any patient identifying information, at the end of the day, you guys need to know there are infections out there. In I've seen infections at Walmart. I've seen infections at HEB. Oh, the newest infection today, Ross. Stop going to Ross.
Oh God, yes.
Please.
It's crazy, sir.
Please.
Crazy.
I had multiple infections that I saw from Ross earlier today, and Lowe's. People are going to Lowe's and Home Depot. Hey guys, the virus is spreading. No matter where you're at, we need to be extra careful. Treat everyone as they're infectious. You wear your mask. Don't touch your face. Continue hand washing and keep praying. Keep praying because this is serious stuff, guys. This is serious stuff. People are dying. No more of these fear mongering BS. This ain't no fear mongering, man. This is reality, and we are getting tired. I can tell you, I'm not a robot. I'm not a Superman. I'm a human being, and we're feeling the tired because there's overwhelming every day 100, 50, 60, 80, 100, and it keeps going. And you know how many infections we produce at the sports park? We've produced over 1,051 infections, 1,051 from March to now. And I'm not giving you the numbers because we're also took on the task of going into the nursing homes.
Oh,
No one wanted to go into the nursing homes. No one had the pants to go into the nursing homes. We went in there. We knocked it out in 5 days. We tested 1,900 individuals. Thank God we didn't have one infection in my staff that put their lives on the line. After we left the nursing homes, unfortunately, now there's a lot of infection in those nursing homes, and there's more deaths in nursing homes now than there was 2 months ago in Brownsville. First it was in Harlingen, now it's in Brownsville. It's serious matters.
Doctor, you previously spoke about infections occurring at Ross. With the recent spike in numbers and the governor suggesting or hinting of a possible shutdown on the horizon, you as a medical professional, would you recommend our city officials and even our governor to strongly consider a possible second shutdown?
Yeah, I think they got to call an emergency shutdown. The governor has to declare disaster, and the governor has to request the reality. Oh, Dr. Teresa Saavedra is one of our medical directors. She's on here, and she's an excellent physician, guys. She's a family dog out of Suclinica. She's partnered up with Valley Med Urgent Care, and she's also overseeing a lot of our projects. So she's on here. We want to congratulate her for being active with us and being so helpful, Dr. Saavedra. So thank you for being on. And we're focusing on a team approach for these cases. But at the end of the day, I think we got to shut down. The virus is out of control. We need to declare a disaster by the governor, and we need to take precautions for this not to continue into a downward spiral. Okay, because the hospitals are now overwhelmed, and we have not hit any peak. I think Erasmo was more correct than I was. I said that we were going to peak at the end of May. In all honesty, when I saw the reaction of the individuals, and we're barely beginning to hit that curve. So we're not flattening no curve. It is serious matter. There's 40-year-olds dying. There was a 42 and a 45-year-old that coded at a local hospital, and they did not make it. And those numbers you can't compare an 80-year-old to a 40-year-old.
No, not at all.
How they're serious.
Doctor, and I appreciate the comment again. And no one knew. And again, the only reason I guesstimated was because a lot of the trends going on. And again, you and I have had these conversations with Mayor Mendez, and now I wish I would have put some money on there because maybe I'd be a little bit richer today. But again, no one knew, no one knows. And again, a lot of it has been our fault. You did mention nursing homes, sir. And let me tell you, one of my biggest concerns, and when we started doing these shows, was the nursing homes because of the situation that happened in Harlingen that we were able to, to bring to the light. One of the things that it's very concerning to me, sir, is that we know for a fact that Miranda Grande Manor here in Brownsville has multiple positives, but we're not seeing them being reported on any of the lists produced by Cameron County. Why is Cameron County so slow in reporting the numbers?
Well, I think that's a question that a lot of people ask. The reality is the following. When we diagnose COVID-19, we do the collection at the sports park. The patient gets their evaluation with the results. The results can take anywhere from 3 to 7 days. There's a huge backlog, even longer right now. There's thousands and thousands and thousands
Wow.
of samples throughout the state, right? So that can put it behind a week. Then when we reported county health, they have to do an investigation. That investigation can take a day or it can take a week. We don't know how much I don't we don't know how much manpower they have, but what I can tell you is the following. The county judge, Eddie Trevino, has done excellent. Dr. James Castillo, our health
Yeah.
authority, has been very active in communicating with me almost on a weekly basis on cases. He's given me recommendations as him being a physician and being in charge of the health department. He's made we've even coordinated care. Dr. Castillo and I have coordinated care for patients up in Hidalgo County to get them tested out of my facility in McAllen. So we are working together. Now, the Cameron County doesn't report in real time. They cannot do a contact investigation in less than 24 hours, guys. So that is the issue. We are not seeing the real numbers in real time because
No.
there is an actual contact investigation that occurs.
But,
So
but
the
something that you mentioned is very important, Doctor. You made mention in regards to a lot of the different situations that we're having at HEB and Walmart and everything else. And look, guys, and someone was asking here, well, then should we not go to HEB and Walmart? No, I don't think that's the thing. But you need to know what, like you mentioned, Ross. We need to know that these places, guys, if and look, we have to go back into things that are logical. Go when it is essentially important for you to go. O sea, no vayas ahí nada más. Voy a ir a Walmart nomás para pasearme. Voy a ir a Ross nomás para pasearme. Go because it is an essential to go. We've already been told, there's issues at HEB, there's issues at Walmart, there's issues at Ross. I still don't get why people even go to Ross. Ross is horrible, so expensive. But
let
again,
me let me let me tell you how to manage the groceries, okay?
yeah,
Everyone needs groceries to live. We need groceries. Go to HEB when they open. Okay, take your sanitizer and sanitize your own cart, guys. Sanitize your own cart where you grab it. Okay, and then take an actual plastic that they give you there for the umbrellas and cover the actual the cart with the plastic, and then hold that with your hands and obviously have your mask on and move throughout the aisles quickly. Do not stop and talk to your buddies. Do not stop and talk to other people that you haven't seen in years. Get the groceries and get out. Okay. This virus spreads through the air. It's possibly that the air vents have an issue, and so
yeah.
we need to move. We need to move quick. You'll go in and you go out. You
This
have nothing to do. You should not be spending more than 30 or 45 minutes at HEB. You're in and you're out,
In and out.
guys.
Sir, this is a good question, and this is a good question for you. Does science really know how it's transmitted? Something new that we should know? I'm going to rephrase this question, sir. One of the things that we have learned is that every day it seems like every day we're learning something new, something new, something new. Y'all were the first ones here, I think, if I'm not mistaken, to pinpoint in regards to the loss of smell, loss of taste, sir. There's always something new to be learned, something new to be learned. Dr. Hernandez, what have you learned recently from this virus that we did not know in March, sir?
So to answer Ana Lydia's question, when we started the testing, I was actually testing before the city of Brownsville came and wanted for me to assist them in the testing. Okay, so that we can get that straight from day one. We were already testing individuals prior, and that was a funny question. So we started testing early on. I looked at what happened in Europe, guys. In Europe, there was 1,200 people in Italy that reported a loss of taste or smell. The CDC was behind on those symptoms. So when I got with Mayor Mendez and we decided to put together our questionnaire and move forward with the questionnaire, I decided I took a clinical decision with the team, and we added those symptoms that no one else was looking at. Okay,
Yes.
and we were able to pick up so many infections, and now that's very common. Now it's progressing to GI symptoms. That's something we added a month ago. Okay, CDC has been behind on that. We added diarrhea and abdominal pain, which is common with the virus, but it was not described earlier. Okay, and at the end, the CDC has added three more symptoms, uh, and the three more symptoms are runny nose and fatigue and things that we normally get with the virus. So we have been very, very, very studying other countries, studying at other issues from other folks. Okay, so we've been very active, guys, and trying to keep our eyes on other countries, what has failed, what has succeeded, what has helped us, and we've also kind of improvised ourselves. We have, with our lab account, we are a top 5 state account for our lab in the state of Texas. Okay, that's how much testing we've done, and that only tells you what commitment we have to the community. People want a test, they can get a test. Unfortunately, at this point, at this point, we are lacking supplies. The labs are in the background, okay? And at the end of the day, we are stuck. We are stuck. We are limited by the labs. Now, the labs run on reagents. If they don't have reagents, they can't run the test. If the lab employees get sick, who's going to run the test? There's a lot of variables, and we're in a point where we're stuck. Now, we are averaging, guys. We started with 50 tests a day. We started with 100 tests, now 200. We've done up to 283 tests, Frankie. We've done up to 283 tests per day. We are trying to get to everyone that we can on a timely manner. Please do not, don't send us any hate mail. If we don't get to you, it's not because we don't want to, it's because we at this point cannot get to you. We recommend that you seek care, and if you have an emergency, please call 911 or go to the ER if you
Yeah.
have an emergency. If not, reach out to your family doctor. You'll be surprised what they're coming up with. A lot of family doctors started testing now.
It's good.
Doctor, what?
Question in regards to bringing on Dr. Saavedra. Dr. Saavedra has an open invitation. Please, Dr. Saavedra, if Dr. Saavedra could offer us a good 30, 45 minutes, we'd love to have you, Dr. Saavedra. Frankly,
Dr. Hernandez, we've been catching a lot of heat from business owners, and we totally understand their situation. Me not being a business owner, I do not understand, or I cannot comprehend the amount of pressure and stress that these entrepreneurs and business owners are in. It's hard for me to say, "Oh, shut it down," when that's their livelihood. What's your message to these business owners who are dealing with this crisis as we speak?
I think as any business owner, I mean, they have their livelihood at hand. I would be happy to see if the federal government could provide some type of support, like they had the PPP loan at the beginning for those individuals, but that money ran out. And if you're gonna operate a business for livelihood, make sure that you're taking all the steps in the precautionary to prevent any further spread. Now, I cannot vouch for bars. Bars are not in the same area of other locations because the bars, people are so crowded, they're close up to each other, and they're having that. I don't recommend this any business that's not a bar to really focus on this. But bars should stay closed, and every other business should find a way to survive. We should support our own. But we're all everyone's in the same problem. We're in the same storm in different boats. So some are more blessed than others. If you can extend a hand to help an individual, please do so. Please do so.
one of the things that Rodney does make mention, we are, there are so many comments, Rodney. We are really trying to get to all of them. But I do appreciate one of your comments. You did make mention in regards to South Padre Island, and I did see it. South Padre Island is actually owned 90% of it by people from Mexico. People from Monterrey actually are probably own 90% of the island. And I would agree with you on that fact. With that said, Dr. Hernandez, one of the staggering news that we have received from Matamoros, from Reynosa, is how our doctors are passing away, sir. Our nurses are passing away. Individuals that are out there on the front lines fighting. And Dr. Hernandez, that is one of my biggest concerns, sir. My prayers are always for you and your team, Dr. Saavedra, and all the other amazing Dr. Cerdan, all the other Dr. Samir, all the doctors that are on the front lines, sir. And my sister's a nurse, so I have a more invested interest in it, sir. Because our prayers are out there for you, but prayers are not enough. We have to guarantee that we don't overwork you, that we don't overcrowd you, that we don't, have our hospitals passed, like Dr. Amil said, that they're at 107%, 104% yesterday, 102%. Sure, the only way that we're going to slow down this massive spread is if we continue to social distance, we continue to hear y'all's counsel, y'all's advice, CDC guidelines, sir. What is the message in regards to the mental anguish that y'all are suffering out there?
Man, it's a strenuous process. It's mentally and physically scary when you get to a point to where when you see no way out. And so a lot of these individuals, there was an ER, I think there was an ER doctor that committed suicide up in New York.
Yes.
We don't want to get to that point. We encourage if there's any healthcare professional that is having a situation, they can reach out to the colleagues, reach out to us. We're open 7 days a week. A lot of you all have my cell. We're here to help each other. We're all in this together, guys. This is not no competition. We all need to help each other, and we all need to work together. But medical professionals are human beings as well, and they're gonna have feelings, and they take a lot of these scenarios home with them. They're seeing death every day. They're seeing the system not work. All they can do is look at the board of their ICU being full. So at the end of the day, it is very tough. It is tough for anyone, and even the spouses is difficult. It's difficult for the families. When I come home, I don't let my children touch me. They're not allowed to touch me. They want to come and hug me. They can't. I've got to run. I've got to run to the shower. I've got to put all my clothes away, get it washed, get in the shower, get decontaminated, and then move on from there. So it's a sad reality that we're all living through.
Well, one of the things is like, in regards to the Walmarts and HEBs, and it's nothing against Walmarts, HEBs, and Ross, guys. The issue is like they tend to have a lot of people out there in bunches, and that's the things that we need. Look, and it's very hard. Like the same thing with the classroom, sir. I put up a post like a couple of hours ago in regards to let's say that the schools, it's crazy, but let's say they decide to send our kids back. They're going to have to be disinfecting every hour, or every so forth, just to make sure that it is clean. And that's one of the things that I think it's very hard for HEB, Walmart, and Ross to do. They can't be out there disinfecting every hour, every 2 hours to guarantee that it's going to be safe. So if you linger there for a long time, if you're out there in big old bunches, that is how we're going to get this virus spread all over. That was our concern with 4th of July. That is our concern with sending our kids back on campus. Sir, look, Cameron County, sir, have you seen the list of Cameron County employees that have turned out positive? I mean,
well, a lot of them are testing through us, so we speak to a lot of them. Okay, and so I think a lot of the key, Erasmo and Frankie, for prevention of the spread in large companies like HEB and supermarkets is, I think we got to encourage those individuals, those groups, to really push for high filtration efficiency air systems where they trap the viruses in their air filters. Okay, they got to work on their air filtration so the air is cleaner. As the people go with covered masks, that reduces the spread, and then you have a better filtration system, and then you reduce your chances by moving in and out of HEB as fast as you can, decontaminating everything that you buy before you put it back into your fridge or into your cabinets. So there is a long process that people need to follow to stay safe when we go to those locations.
Dr. Hernandez, this is a very good question. And this is one of the questions that I've been getting a lot, sir, in regards to the 15-minute test and the difference between the swab, the blood test. Can you give us some insight in regards to the different tests, which is more effective, which is less effective? And also, individuals have mentioned false negatives, false positives. Information in regards to the tester.
So I think Jessica, I've seen her make some comments and some excellent questions. So at the end of the day, the most sensitive and diagnostic test for COVID-19, SARS-CoV-2, is going to be a PCR test. What does PCR stands for? Polymerase chain reaction. What the swab does, guys, it takes viral RNA and puts it into an analyzer, and then we as human beings have specific enzymes that we can put on there with TACMAN, real time PCR, and we can multiply that RNA, and we can detect if you have it or not. Okay, that is the most sensitive test. Now, there's a lot of folks out there with 15-minute tests. We have to be careful about those tests. Uh, the 15-minute test, if it's a rapid antigen test, it checks for the virus, a protein in the virus specifically for COVID-19. I think that's an excellent choice. If you can have that test, it gives you a 15-minute result to let you know that if you do have the virus or you don't. If you have the virus, go home and isolate. You still need a confirmation test. You still need a PCR. Now, there's another test that you can get is the reality of going through an antibody test, guys. But the antibody test won't show any positives until 3 to 5 days after symptoms. Okay, so you're already in symptoms when you can test positive for the antibodies. You've already affected people around you. The gold standard here, guys, is the nasal swab, the PCR that we're doing at the sports park and they're doing at the hospitals. That's the gold standard. Now, if we need to move into antigen testing to diagnose people in the 15 minutes quicker, I think it's excellent. Now, also, Dr. Saavedra is our medical director, and we were having this discussion earlier. If you have COVID-19, there's an article that I'm going to put out that she sent to me that we were discussing earlier. That if you're supposed to lie down, if you're having shortness of breath, if you're having COVID-related complications with your breathing, being face down reduces a lot of those symptoms,
Wow.
and that has been proven. We have the article. We will share that with you guys. So now we are actually letting us know our patients, if they're having shortness of breath with the disease, to when they sleep at home, sleep prone, lying down. That helps your breathing, and that's a proven scientific fact.
Dr. Hernandez, I have a question for you. Es correcto que si se pones parches de nicotina te ayuda, and we did see some information in regards to nicotine, sir.
Yeah. So when we went into the nursing home, guys, we did 1,900 individuals in 5 days. All my staff wore nicotine patches.
Wow.
Every single individual. Okay. If you look at France, in France, the French healthcare workers are wearing nicotine patches. It is believed that the virus enters the nose into the olfactory nerves in the nose, and when you have nicotine available, those nicotine products bind into the receptor where the virus cannot integrate into the body, so it pretty much blocks it. So we were studying this, and prior to going into the nursing homes, I actually bought the nicotine patches for my staff, and we went and we got it done, and they didn't have serious infection. So there's a study about the French workers that are doing this, guys. They're doing this in France.
Hey, doctor, I have heard from people that they've been receiving medications from Matamoros because they tested positive. Is there any such sort of medication or treatment available to people who have tested positive?
So we've treated over 1,000 individuals, Frankie. So every case is different. Every case is case by case. But I have prescribed hydroxychloroquine. I have prescribed antibiotics. I have prescribed ivermectin. I have prescribed steroids. I have prescribed Tesalon pearls. I have prescribed albuterol treatments if the patient is having wheezing or any other shortness of breath. There's a lot of medications that we can use in our medical arsenal, but it's really dependent on the patient, their comorbidities, and their how sick they are at the time of the consultation. Most people don't require any treatment at all, but there's some that require quite a bit of treatment. And if we don't treat them, we don't educate them, they're going to be one more person in the ER. But guess what? The ER now has become a breeding ground for COVID-19, and they're swamped.
Yeah.
And if you got to go into the ICU, you don't have a bed. So we need to be aggressive on the outpatient setting to prevent individuals from getting hospitalized. And that's what we've been doing since day one.
Dr. Hernandez, this is one of the questions that I've gotten a couple of times in regards to the testing, and you could give some clarity. How is letting patients administer their own exams, no swabs, affecting the accuracy or of determining a patient tests positive or negative cases? Shouldn't healthcare providers do the procedure to assure accuracy of tests? Would it be appreciated if you all answer this?
And in a perfect world, we had 30 healthcare workers at the sports park with each individual, each car. It is a possibility, but the CDC put some new guidelines, guys, and I'm gonna tag you guys on there. March 26th. I'm sorry, they put new guidelines in self collection technique and anterior nary swab. So you go in 1 inch in the nose and you swab that 15 seconds in each side. If the virus is present in the nasal mucosa, you're gonna pick it up. It doesn't matter if you do a self collection or if you have a licensed practitioner or nurse or doctor collect it for you. There is a lab test called by LabCorp called the Pixel. Have you guys heard of the Pixel? Okay.
Yes.
You buy the Pixel, it's $109. They ship you the test to the house. You do your own test, you send it back to the lab, and then you can take that to your doctor. And it's a self-collection technique. It's approved by the CDC. It's recommended. And guess why we have zero infections at the sports park? We do supervise self-collections for individuals. Now, with that being said, Frankie and Erasmo, if there's a child under the age of 2, under the age of 6, we've swabbed ourselves. My RN on staff has swabbed kids as early as 2 to 3 months,
Yes.
guys. So if we need to swab an elderly, if we need to swab a child, if we need to swab anyone, we're going to get it done. The fact is that when you come to the drive-through, you're going to get a test. If you need help, we'll get it done. We walk you through it. And thank God we haven't had one infection out there.
Good. So I got 2 questions for you, doctor. The first one is from Joe. Doctor, my daughter tested positive at the sports park and received a phone call to let her know to stay home for 14 days. However, nothing was prescribed, no antibiotics, or wasn't referred to a doctor. I tried to get her an appointment, but wouldn't see her. Is there anywhere I could take her for antibiotics, or does she need them?
Well, I think, more likely his daughter's under the age of 20, guys. So when you're under the age of 20, you don't need anything but symptomatic care, Tylenol, over-the-counter cough and cold syrups, vitamin C, zinc. As you get older, you have more comorbid conditions like my diabetics.
Right.
I had a lady that tested positive today. Her blood sugar was in the 300s. She got antibiotics. The reason she got antibiotics is not because the antibiotics are going to work against COVID-19. She could have a super infection, a pneumonia from a bacterial infection because she has such an uncontrolled blood sugar, and we have this vicious virus ravaging in her system that she can get a bronchopneumonia as well. And so we cover her with antibiotics. So antibiotics do not attack viruses, guys. So that's a misconception. Not everyone gets a treatment, and that's viruses act differently. We don't have an antiviral to this moment that can attack the virus.
Great question. And Diana has, Doctor, I have a brother-in-law working in San Antonio Hospital with patients that have COVID. He said they are being given patients Pepcid Complete and that a lot of patients have recovered. Do you know anything about this? It's for acid reflux, but it contains something that's been helping for COVID.
So Pepcid is basically famotidine. It's a histamine blocker. Histamine gives us a reaction in our bodies for allergies, and for also produces for the parietal cells in the stomach to produce acid. I don't see how that's correlated to COVID-19. Let me read up on that. I've never seen heard of Pepsid. There's other things that I've used that are we've been very successful. You know, out of our 1,000 patients that we've diagnosed, we've had under 10, possibly less than 10 hospitalizations, and we've had zero deaths from our efforts from people that we've treated.
Out of 100 tests done on a daily basis, what is the turnaround time to get the results? And are they accurate, or can they be considered as such, i.e., accurate?
You know, we're doing 200 to 250 tests, 250 tests a day, and you know, the lab is in a backlog, guys. Now we have two labs. We have our original lab. We got that lab back on Monday. This Monday, we start again with the original lab. And then we have a partnership now with the medical school, UTRGV Medical School Diagnostic Lab. Those individuals out there are very quick and very efficient. They're giving us results in 48 to 72 hours. So that's a much improvement from a
They
week
did.
that other lab. So it's been faster. It's been faster. So those tests are very accurate. They're very accurate, guys. If you're having if you're having symptoms, you treat the patient, not the lab, guys. So if it smells like COVID, looks like COVID,
It must be
and you
COVID.
can't smell, it's COVID.
Dr. Hernandez, how are you? How are y'all testing patients with COVID? Well, how are y'all treating patients with COVID? Any medication? Any suggestions? Any recommendations?
Yeah, so we do have a medical regimen in our arsenal of practitioners that are involved. We've used everything from hydroxychloroquine to ivermectin to antibiotics to symptomatic care to nebulization. Actually, zinc, high doses of zinc, high doses of vitamin C. If you look at what New York did, New York provided high doses, mega doses vitamin C for their ICU patients through the IV. So we're looking at different treatments. We have deployed several treatments, and our outcomes are great. People are recovering. Our folks are recovering. We're happy for that. There's a 98% recovery rate.
Physician suicide is real. Yes, please reach out to any colleague. Guys, it is, again, Dr. Hernandez, I speak with a lot of the individuals that are working inside the nursing homes, a lot of individuals that are working at the hospitals, and they are concerned. They are concerned. And, it's not so much that they love what they do as you love what you do, sir. Um, but they have families, sir, and they're afraid for their families and for the sustainability of the such with everything that they have to go through. And there is burnout, man. You have to understand that a lot of my people out there, they're working double and triple shifts out there. And again, guys, the only way that we're going to help our medical staff, our medical personnel, our hospitals, the only way we're going to help is by adhering to the guidelines and the recommendations. Stay away from each other. We've been saying it for months, Dr. Hernandez. Stay away from each other, please.
Doctor, I have a question. Hi, could you ask him if someone has seen patients in his office? My sister is diabetic and high blood pressure and has been trying to get her refills. She is in need of her med, and we know he's really busy and appreciate everything that he's done. He's the primary physician.
Yeah, so we're here to help folks. I mean, we're still open. We're still open, guys, for our regular patients. Do not feel like we've abandoned you. You guys have a lot of our contact information. If for some reason my staff does not get back to you in a timely manner, get a hold of me. You guys know how to get a hold of Erasmo. Send a message to me. I will more than likely myself take care of the issue. Whenever there's been any issue, I get involved and I take care of it. Now, we do encourage people to seek their medical care and follow with primary care doctors, but we're also in urgent care. And if you need the help, we're open 7 days a week, and we work this whole weekend.
Yeah, and let me say, I know Dr. Hernandez. I've known him for a while. I mean, I love this man, and I'm very, very proud that a lot of individuals that have had these emergent questions. Dr. Hernandez is like a minute away, guys, and I appreciate Dr. Hernandez greatly because again, he's on the front line, and again, thanks to Dr. Hernandez and his staff, his team out there. They actually went out there and did something that is much needed in this community. He was proactive proactive in going and speaking with the mayor, guys. That's what we need more of here in the city of Brownsville and Cameron County. We need more leadership to be more proactive. And I'm reading a lot of the concerns out here in regards to going to schools. And I'm sorry, guys. And a lot of people may say, "Oh, it has." No, guys, we've got to reconsider bringing our staff and our people back onto campus. Something that you mentioned in regards to the air filtration is very, very concerning, because I seem to think that there's a parallel, sir, with going into these enclosed buildings like Cameron County buildings, the school district buildings, and the other buildings that might be somewhere where the virus contains itself and is being filtered through the system. I mean, is there any logic to that whatsoever?
So the virus does have if there's a study on the virus. It allows you to know that depending on temperature is how much it is available. It is alive technically or viable in the air or in surfaces. So if you have an AC that's cold and makes that area viable for the virus, that can go through the air vents very quickly, and this is possibly how people are being affected.
It's sir, and look, and again, as people have been making questions in regards to the situation in Central America and South America, sir. It's horrible down there. It's horrible, and we just want to make sure that we protect our people as much as possible. One of the things that we're starting to see, someone may mention, I don't know how true it is, that in Hidalgo County they already have the freezer trailers, sir. They're already preparing the
I,
freezer trailers, and
that it, yeah, I saw that. I saw that picture.
that it might be coming down to our area, Cameron County, Brownsville, Texas. Let me tell you, that's very, very concerning. I mean, if that's not alarming enough, I mean, I don't know what else is. One of the things that we're very blessed is that we are having these nurses come in, sir. There's strike team nurses coming in, and I think that there's going to be more on the way. Are any of these planned to come down to Brownsville? One, two, sir. One of the things that we've asked for is for the city to be a little bit more proactive in regards to opening up a lot of the buildings to make hospitals out there for us in order to prepare to plan. One of the things that we've suggested is the sports park has a dome. I don't know if you all are using it, but is there any way that we can encourage our city leadership to transform that into a makeshift hospital, sir?
I've been in the dome. We originally had our meetings in there when we started the sports park. That became a reality within 3 days, and but after that, we all of our work is outside of the dome.
Right.
But I know they're in operation. I think a management team have lots of meetings in there, and I think that. I mean, I just want to give a shout out to Trey Mendez, our mayor. He's been very active. He gets on this show. I mean, this man has been active. I think he's the most active mayor that fights COVID-19
Easily.
in the valley, easily in the valley at a minimum. So we're always talking and we're always shooting ideas because he generally cares about this disease and how it's impacting all the community, all of our families.
So, do you think it's a good idea, sir, possibly to transform the dome into a hospital? Prepared for ICU, prepared for the patients, because we're already getting overflown, or some other buildings, sir.
I think that's an amazing. I hadn't thought about that, but obviously that's excellent. The reality is, can we get enough ventilators in that ICU? Do we have the capacity to buy the ventilators? Is there enough supply? And who can give us the ventilators? Because there's very capable people, nurses, physicians, doctors, PAs out in this community that can knock that out. But the question is, can we get the ventilators?
Doctor, in the 3-4 months that we have been dealing with this virus, Cameron County is at close to 3,000. Hidalgo County is a little bit over 5,000. Where do you see the lower Rio Grande Valley being in the next 3 to 6 months from now?
Frankly, I mean, right now we're living day to day, man. Our day to day is complicated, and we know there's more and more positives and more complications, more and more deaths. Also, Erasmo, I think this is a good time to discuss now. I've been speaking to a lot of pharmacists. The pharmacists are getting plowed. Okay,
Yeah.
the pharmacists are getting. When we speak to a positive, when we prescribe any medication, we tell them you cannot go to the pharmacy. You have to send someone that hasn't had contact with you in 14 days and pick up the medication through the drive-through and get it dropped off in your mailbox or at home, outside your door. But some of these people are showing up to the pharmacy very desperate for whatever medication it might be that they're getting or needing or believe that they want to get, and they're exposing the pharmacists. The pharmacists they're getting beat up, they're getting plowed, and they're very on the edge. I've gotten several calls from the pharmacists in charge of CVS in Alton Glore. I use them a lot because they're open 24 hours, and they're very concerned, man. They're so when I speak to them, they're in the dumps. They sound discouraged. They sound like they got so much volume and so much disease around them that they could just walk up and leave. That's how sick. That's how sick they. You can hear it in their voice. We need to help our pharmacists, guys. If you're diagnosed with COVID-19, do not get off in the pharmacy. Do not get off in the pharmacy. Call them, negotiate with them, get on the phone. If you don't have anyone to get your medication, talk to them about an option through the drive-through. But do
And
not get off.
do not get off. And guys, and one of the things I think the resources that we have in regards to a lot of the medication, pharmacies are running out as well. I think we're at that point that we're going into a very very crisis situation. Sure, a lot of individuals have mentioned that Brownsville, the valley might become an epicenter. What does that actually mean?
The epicenter is somewhat similar to what happened in New York. There was a concentration of the virus, and everything overflowed, and there were so many complications and deaths and realities from that virus. It's possibly that the valley can become a small epicenter in a parallel with a minor population density, of course, to New York City. This could be considered an epicenter.
Guys, Dr. Hernandez, in regards to mask use, proper mask use is essential. Why is mask use so essential, sir?
Guys, so the virus spreads through respiratory droplets. So as you're breathing and as you're speaking, you're producing droplets. And those droplets could be zero point 0.3 microns or less, and you can breathe them in very quickly. If you have a covering, it's very hard for that droplet to come out. And if you have the other person has a covering, then you have two methods of how do you block that from entering your system instead of having just one. So the reality is masks do help. Depending on the type of mask, obviously, I don't support cloth mask. I think we got to be careful with those. Um, we need surgical masks. Let's get in a program where we can all have surgical masks, and then after having your surgical mask, then you should be able to sanitize those. You can buy an actual, you can buy a bottle steamer, place the mask in the
Yeah.
bottle steamer, and sterilize your own mask, guys. The mask get contaminated. You will see many infections happen because people have contaminated masks. They got the virus in the mask from someone else, and then they touch your eyes and their nose, and that's it for them.
Sir, I tested positive. When would be safe for me to return to work, sir?
Another thing we want to put out at Erasmo is the following: when you test positive for the virus, we have dealt with over 1,000 positives. We know how this works. You're gonna show positive on your test week 1, week 2, and week 3 after your first initial positive test. I will not retest you until week 4. In week 4, most of the individuals test negative. Okay, we're not we can't be wasting supplies on people that want to get a test within a week of being positive. Guess what? You're going to be positive for 3 to 4 weeks. Okay?
Right.
It doesn't mean that you're completely sick or ill from the virus. You've probably beat the virus, but the end of week 3, you're going into week 4. But if you have a virus, It doesn't go with a viral culture of being infectious, but those particles are there. The RNA of the virus is there. And my experience after 1,000 positive patients, it takes 4 weeks to show negative on a lab result.
Hey, doctor, doctor, how do you recommend decontaminating our HEB groceries?
So what you do with that, guys, make sure if you can go with gloves to HEB, pick out everything you need to pick out. When you bring that home, decontaminate it. If there's vegetables, wash it with soap and water, okay? And if it's something that it is in a carton or in a hard surface, you can take a disinfectant wipe and wipe the milk carton box, wipe the boxes, or take it out of the boxes that are contaminated and into the cabinet. So there's a lot of things that we can do ourselves to prevent the spread. Treat everything like it's infected.
Doctor, would you recommend us to avoid going out and eating at restaurants during this time?
Yeah, so I think eating at restaurants now is an issue. If it's an outdoor restaurant, and if you're outside and it's not crowded and there's one or two tables, hey, that doesn't sound like there's nothing alarming about it. But if you're in a restaurant with multiple tables, right? You multiple tables next to each other, you will have problems, and that's what it is. PCR. I think they're talking about PCR. Yeah, PCR is the test of choice, guys. If you can get your hands on a PCR, get it.
Do you know if that group that's coming down, there's that TexasCovidTest.org. I think it's National Guard that are doing the test, Armory Guard, I'm not sure. Do you know which test they're performing?
So they're doing the PCR test.
Okay, good.
But what I'm seeing is that a lot of those individuals, they don't have anyone to follow up with the results. I think that's important. If you get a test with the National Guard or the Texas Guard or whatever whoever is testing, make sure you get a way to contact them to get your results, and then you can telemedicine through us or through any other practitioner out there, so you can get those results evaluated. I think that's an issue that's occurring when they test.
Doctor, we've heard how Los Fresnos have had a limited amount of testing during some days. How long is a sports park able to run? Let's say for the next week or so.
In supplies?
Correct.
No, we can do 1,200 to 1,500 tests at a minimum per week.
Wow, that's awesome.
We're very powerful in this. We have the most tests than possibly anyone here in Cameron County, I believe.
That is amazing, and that again goes to show being proactive, sir.
The mayor.
And what you and the mayor have done, sir, has, I think, saved a big old chunk of Brownsville, sir. So hats off. Dr. Wittenberg does share with us National Suicide Prevention Hotline, which is 800-273-8255. Guys, please do not hurt yourself. If you need someone to talk to, if you're feeling down, please give me a call. You have my phone number. It is public record. You inbox me. Do not harm yourself. And please do not harm others either, guys. And again, suicide is just hurt all over the place. It doesn't only hurt you, it hurts everyone that is around you. We will have Dr. Wittenberg with us tomorrow morning. So we'll talk a little bit more about the mental health aspects of it.
Dr. Wittenberg, make sure they discuss tomorrow. There's an antidepressive called fluoxetine Prozac that has been shown to be a treatment or to fight the virus. Very interesting. I'm going to share the article with you.
Awesome.
Okay? There's an antidepressive medication that has been shown to fight or inhibit COVID-19. So it's very, very interesting.
Dr. Hernandez, what about you read on there's been some things on the news in regards to O blood type.
I've seen it. I haven't studied it.
Okay.
The physiology of why it makes you less susceptible. We've been so stuck with treating positives, and it's just been out of control, man.
Oh,
Doctor, I have a question. There have been saying that the rapid testing is not giving the correct results, recommending to do the swab test better.
So again, guys, the swab test is the gold standard. Okay, the gold standard for is a PCR swab test. But at the end of the day, there is a 15-minute rapid antigen test that checks for the virus, and this is very accurate. If you're positive, you're almost at 95% chance that you have the virus. You need to go home and isolate. You get 15-minute results. Um, if you want a confirmation, then you get your PCR. The antibody testing is also a very good testing, but it doesn't operate as efficient as an antigen test because you have to wait till you're symptomatic, 5 days after symptoms. So, and that checks for two antibodies. So, if you're going to be tested for COVID 19, it should be a PCR gold standard. If it's not a PCR, possible an antigen test will tell you in the next 15 minutes if you have COVID 19 or not.
After being tested positive, how long should we wait to bring in professionals to spray down our home?
So, I mean, it all comes down to who's positive at home. If you have multiple members positive at home, make sure that you guys you're infected with the same virus and the same strain. So at the end of the day, if everyone is infected, you all will come in of the isolation and then go out of the isolation together. And now, if there's different members of the family, that some are infected, some are not, you have to practice the precautions enough to where not sharing the restroom, not sharing utensils, staying away from living areas, making sure there's adequate good filtration. If you're in a room upstairs, make sure open the doors, let the air ventilate out. There's a lot of things you can do. We have seen prevention of infections at home. For the most part, if there's a parent positive, the kids are positive.
Good. Sir, do you need, well, in regards to getting tested, guys, I'm going to shout out, please go and fill out the questionnaire, btxcares.com. B as in boy, txcares.com. I've been posting it throughout the day. I'll continue to post it throughout the day multiple times. Send me an inbox. Also, txcovidtest.org. And I have a list of other doctors that may or may not. Again, you just have to go down the list in regards to testing. I did have a question. Can you explain why COVID virus creates tentacles in the cells?
Wow, that's a. I'm not. I haven't studied that. It sounds like a cell biologist there, but the coronavirus does have these type of spikes that make it look like corona. I'm not too sure what Benedicta means by that other portion.
Could you give us information in regards to plasma and how it would affect a COVID patient?
Yeah, so we do encourage. I think Dr. Beverly Zavaleta is manning the plasma center for Valley Baptist in conjunction with other partners. But when you have plasma antibodies, IgG, versus against COVID-19, if someone is in dire need of fighting the virus, you infuse that individual with plasma antibodies that completely eradicate or neutralizing antibodies. They neutralize the virus. It allows your body to fight and it gives you a fighting chance. So this treatment works. Convalescent plasma actually works, guys.
So if you test, I'm actually curious. If you test positive once and after you wait 4 weeks, you test negative, can you get infected again with the virus? Can it return?
So coronavirus, there's multiple strains out there that cause common colds. The one that we're concerned about is SARS-CoV-2, COVID-19. So there is some studies that mention that the reality is that you have immunity up to 3 to 6 months at the moment. We don't know longer. So it could be that you can get a reinfection in 3 to 6 months. At this point, we don't know.
It's too novel of a virus. And again, we're going back, and I lost who asked the question. I think Alicia. I think right now there's just a lot of unknowns. We just don't know. And a lot of people say, well, Erasmo, you're being too hard on the governor. Look, the governor's a friend of mine. I speak to him every Saturday night. We have great conversations, guys. He texted me on Friday. Great conversations. So no, but I want to call out the governor when I think that they should have been a little bit more proactive. But with that said, we all have to understand that, they're just trying to do what is in the best interest of everyone. I don't think that anyone out there wants to necessarily kill anyone. I think a lot of times our elected officials, they get blinded by the facts and don't want to appreciate the science. And right now, the science is very, let's see what happens tomorrow. That's the way the science is. Because something that we'll say today, next week we'll have Dr. Eder Hernandez here again, and Dr. Hernandez is going to say, well, you know what, guys? It's now it's mutated, now it's changed, now we've learned something other. So, guys, let's be patient with our individuals out there, our doctors, our scientists. I mean, they're learning as they go as well. And there's a lot of things that Dr. Hernandez won't know. And there's a lot of things that Dr. Cerdan, has said, we don't know. But they are doing their best to stay up to date. And that right now it's very, very hard because they are literally on the front line here in the city of Brownsville. So again, Dr. Hernandez, to send our love and our appreciation, our prayers to the staff out there. We're going to ask Dr. Saavedra if she has some time to please come on as well. Dr. Hernandez, anything else that we need to know, sir?
No, we first of all, we our prayers are with you, our families, the city of Brownsville. Everyone is acting in good faith. Trust me, it was very hurtful earlier throughout the day to see Dr. Irina Menina had negative comments towards her. Dr. Menina has tried to help our community with COVID testing, and there's different people doing what they can. I mean, no one's here to hurt anyone, guys. We're here to do the best job that we can.
Amen.
We're not perfect, and help us help you and help each other. Listen to us. Stay home. If you don't need to be out, don't go out. If you don't need the family gathering, you don't need the pachanga, you don't need the carne asada, you don't need the bar at the beach right now, because trust me, once it hits home, it becomes a harsh reality.
Well, we have to understand, sir, that we're all in this together. We're all in this together. All of us. I sometimes feel fatigued, sometimes, and tired as well. I'm losing my voice. But again, I hope that one of the things that we can do is continue to inform individuals out there. Our community needs to be informed. And you know what? And Dr. Hernandez, I know that, look at all the comments, all the praise, all the numbers. People are very appreciative, sir. They're very appreciative. And, your time is golden, sir. Your time is golden. You're taking away time from your family to be out here and, to answer. And look, and Dr. Hernandez, we don't prepare for this. We don't have a script.
Oh, yeah.
We don't say, hey, Dr. Hernandez, we're going to ask you these questions. We're not going to ask you these questions. We try to get to all the questions, guys. Sometimes it's hard because of all the response, but we'll do our best. Dr. Hernandez and staff, they are doing their best. And guys, please be supportive as much as possible. Be patient. No se desesperen. Be calm. We're all in this together. We're all fighting for the same thing, the health, the safety, and the well-being of our children, of our community. So please be patient with our people out there. And please, no negative comments to Dr. Medina, Dr. Saavedra, Dr. Cerdan, Dr. Hernandez, Dr. Samir, because these individuals are out there for us. Dr. Amil, they're out there for us. They're doing their best, guys. Please, let's be appreciative. Let's be supportive. And, let's buy them a cookie. I still got cookies. Cookies. I already ran out of cookies. Frankie, last words.
Thank you once again to Dr. Hernandez. Thank you for taking the time to keeping our community informed. It's very important. Just got word, guys, that Reynosa is reporting 190 deaths, and they do have a crisis on their hands. This is something that's getting bad to worse. We recently saw the pictures of people at South Padre Island and how packed it was. So we are obviously not listening to the recommendations of Dr. Hernandez, Dr. Cerdan, and other doctors within our community who have been constantly, advising us to stay home and not be outside. So this is only going to get from bad to worse. And very quickly, I want to commend Los Fresnos CISD. They took the initiative and delayed the opening up of school to September. Early September. So shouts out to Los Fresnos for doing what's right. They are listening to their community. They're listening to our public health officials and realizing the dangers that could possibly happen if we do send our students and staff back to the brick and mortar schools. I hope BISD is watching and listening and makes that same move very quickly. Thank you guys so much for your patience. Thank you, Dr. Hernandez. It's always a pleasure, my friend. Hopefully we'll get to see you very soon, sir.
And
God
guys,
bless everyone.
God bless. God bless you. Guys, have a great rest of the evening. Hey, Baba, thank you for being on, Baba. Awesome. Thank you for sharing your dad with us, okay? Guys, stay safe tonight. Have a great week. Stay apart from each other as much as possible. Adhere to the guidelines. Be good to each other and be good to me. God bless. Take care. Hasta pronto.
Bye bye.
Great job.